One and all, I warmly welcome you to our 17th CellTalk webinar. In today's session, Dr. Shaheen Shah will be presenting research titled Triggers and Alleviating Factors for the Fatigue in Parkinson's Disease. Dr. Shaheen Shah works as a clinical content ambassador at Renix Life Sciences. She has a PhD in biotechnology and is a certified medical writer with several publications in international journals. She has also completed the Good Critical Practice course under the National Institute on Drug Abuse, has worked at some agriculture in University Jorhat as a research associate at the Research Association Toklai Jorhat and in the Regional Medical Research Center, Dibrugarh as senior research fellow. She has also presented several papers, oral and poster within the country. As a medical writer, she aims to integrate her knowledge of science and research in the greatest possible way to present information relating to the medical field in an easily understandable form to the intended population. Her work at Renix Life Sciences has given her the opportunity to work in a rationally demanding and innovative field and has enabled her to give health management knowledge to a global population in the best possible manner. So, without further ado, I now to take the floor.
Thank you, Aditi, for my introduction. So today I am going to present a paper on the triggers and alleviating factors for fatigue in Parkinson's disease. And the original author of this paper is Iris Lee, Brianna Edition, Italy. This paper is published in the PLOS One journal and its impact factor is 3.75. The year of publication is 2021. This research has impact on allied health professionals, physicians, and clinical trials investigating treatments for the Parkinson's disease fatigue. So let us first know what is Parkinson's disease. Parkinson's disease is a progressive disorder that affects the nervous system. The symptoms start slowly with noticeable tremor in just one hand with stiffness and slowing of movement. These disease symptoms worsen as the condition progresses over time. The disease is incurable and medications sometimes improve the symptom. Sometimes the doctors indicate the surgery to regulate certain brain regions and improve the symptoms. Coming to the general background, fatigue in Parkinson's disease has a significant negative impact in both quality of life and carrying out patients' daily activities. Many patients, they find that fatigue is the most worrisome symptom, but only few effective treatments are only available for it. Exploring the triggers and the alleviating factors could inform the development of management strategies for Parkinson's disease fatigue. So with this background, in the current paper, the researchers examine triggers and alleviating factors for fatigue reported by the individuals with the Parkinson's disease. So there are some challenges regarding the Parkinson's disease. So fatigue is very common in Parkinson's disease, but few treatments are only available for it. The etiology and pathophysiology are multifactorial. It contributes to the challenges of developing drugs. Stopping medication may sometimes be associated with the fatigue. Other precipitating factors for fatigue are not well described and understood. Physical activities also appears to have mixed effect on fatigue, but data are very much limited. To address this gap in knowledge and to inform the future development of drugs, the researchers here in this paper examine patient-reported triggers and alleviating factors for fatigue in PD and focus on the patient-perceived effects of exercise on fatigue. So, objective of the present paper is to examine the triggers and alleviating factors for fatigue reported by individuals with the Parkinson's disease, including the perceived effect of exercise. Coming to the methodology, a sample of individuals with the self-reported Parkinson's disease participate in an online survey and it is named as the Fox and Sight study. The survey included 3 parameters, that is Parkinson's fatigue scale, physical activity scale for elderly, and some multiple choice questions reporting the trigger and alleviating factors about the Parkinson's disease. So the data has been analyzed using certain statistics known as the descriptive statistics, chi-square test of homogeneity, and Kruskal-Wallis univariate differences. So descriptive statistics were used to summarize the demographics and questionnaire responses. Chi-square tests of homogeneity compared the groups based on following parameters, such as no effect on exercise, exercise improves fatigue, exercise worsens fatigue, or doesn't exercise. Kruskal-Wallis univariate differences compared clinical characteristic and the physical activity levels. So coming to the results, among the sample of 1,029 individuals with the Parkinson's disease, the mean age was found to be 67.4 years, and among them 44% were female. Parkinson's disease fatigue scale score ranged from 16 to 80. So this is a table showing the subject characteristics. And the subject characteristics are the female, male, age in years, white or Caucasians, disease duration, and about the Parkinson's disease medications. There was found a range of fatigue in the cohort. 48.8, that is 16.2% of the sample were categorized as having fatigue based on the PFS score, that is Parkinson's disease fatigue scale score. This is another table showing the triggers and the coping strategies for fatigue reported by cohort as a whole and in demographic subgroups. In this table, we can see two highlighted sections showing the patient-reported triggers and the patient-reported coping strategies. So most frequently reported patient-reported triggers were a poor sleep, which is found to be 62.1%, followed by physical exercise, which is 45.1%, and followed by a busy day, which is 44.2%. So there are some other frequently reported coping strategies addressed by patients. They are sitting quietly, doing an activity, which is 58.1%, laying down to rest without sleeping, which is 52.6%, and sleeping, that is 48.1%. So the coping strategies were also compared between the male and the female populations. And they found that the most frequently reported coping strategies in male is sleeping. This is found to be 52.1%. Again, the coping strategy most frequently reported in female is laying down without rest, sitting quietly without rest. That is found to be 62.3%, followed by meditating and sitting in a butt. This is another table showing the clinical characteristic activity levels in relation to perceived effect of exercise on fatigue. So the clinical characteristics were evaluated with the help of some scores or in scale, and it is compared with the patient population. So in this table, you can see there are 4 subgroups with no effect of exercise, exercise improved fatigue, exercise worsens fatigue, and the population that does not exercise. So they found that patients who reported that exercise improves fatigue, they are found to have lower scores in all the scales evaluated. That is PFS score, which is Parkinson's disease fatigue scale, then motor disorder scale, that is to detect the motor disorder, and there is another scale called the GDS scale, which is the geriatric depression scale. You can see the depression level in a person. So that was also evaluated, and then SCOPA NS score. This is to detect the sleep cycle in the patients, and NS is the nighttime sleep. Then again, SCOPA DS is another scale to detect the sleep cycle, that is the daytime sleep. So patients who reported that exercise improves their fatigue, they were found to have a lower score in all these clinical characteristics. Then physical activity level were also compared with these parameters. Then they found that the patient population who said that exercise improves their fatigue, they are having a higher PACE total score. PACE is the physical activity scale for the elderly, compared to other 3 population groups that does not do any exercise worsens fatigue, or no effect of exercise. So as I have already mentioned in the tables, so results, it says the frequently reported triggers for fatigue were poor sleep, which is 62.1%, and physical exercise 45.1%. Coping strategies include sitting quietly, that is 58.1%, Lying down with or without napping, that is 20%. Physical activity scale for elderly, that is the PS score, was higher in the patients reporting exercise elevated their fatigue compared to other populations. The exercise was reported help fatigue in half of the patient population, but was perceived to worsen fatigue in others. The results demonstrate that some patients can often recognize the triggers for their fatigue. Patients also use certain coping mechanisms for their fatigue, and the essential approaches that require further research are the daytime napping, caffeine use, exercise, methods to manage the emotions. Demographic variations in triggers and coping strategies indicate that individual approach may be necessary. Coming to the discussion, in this sample of individuals with Parkinson's disease, the physical activity emerged as a trigger and elevating factor for patients. Several triggers for fatigue that were reported may be modifiable. Poor sleep and busy day cited as a major contributor, highlighting the importance of assessing the nighttime sleep in PD patients. 1/3 participants, they noted emotions as triggering factor, while 1/5 participants cited overeating as trigger for their fatigue. Counseling patients on the potential of high and variable temperature may regulate the fatigue. Half of participants reported exercise improved their fatigue level, while in contrast to deaths, 1 in 5 patients reported the exercise worsened their fatigue. Total test scores were also found to be lower in that group that reported worsening fatigue with exercise. Fatigue has been identified as a barrier to exercise in PD patients with fatigue. The factor explained the lower physical activity in group who reported exercise worsens fatigue. The study suggests that males prefer sleeping while females prefer doing activity without sleeping. This may reflect sex differences in the napping propensity. Caffeine is used to manage the fatigue by considerable patient population less than 65 years. This raises possibility that caffeine may help in the daytime sleepiness as well as and in regulating PD fatigue, and warrants further study. Fatigue scores were similar among patients taking different types of PD medications, and the intake of the medication taken higher trigger fatigue. Limitation of the study. Because the study was an online survey, it was not able to capture data from the patient population with the technological and socioeconomic ability to access the internet. The respondents of this online survey study were predominantly white, and the results may not be applicable to all the races. The PACE is a self-administered study, so subjects may naturally over-categorize or under-categorize their activity level while doing the survey. So survey did not query about the doses of the medication they use, and also it did not query about the type of exercise that the respondents are employing as coping strategies for fatigue. Coming to the conclusion, the study describes some of the self-reported fatigues affecting fatigue, such as physical activity, poor sleep, and stoppage of medication. The exercise was reported to help fatigue in 1/2 of the patients, while it was perceived to worsen fatigue in others. The results demonstrate that some patients can often recognize the triggers for their fatigue, and counseling patients can make their symptoms low, or investigating their lifestyle or changing them may also avoid their triggers. Patients use various coping mechanisms for their fatigue. The results suggest several approaches which need further research, such as intentional daytime sleep, then caffeine use, exercise, and methods to manage the emotions. Demographic variations in triggers and coping strategies indicate that the individual approach may be necessary. Individuals with Parkinson's disease have several behavioral and behavioral triggers and elevating strategies for fatigue. This study may help further development of treatments or coping strategies for Parkinson's disease fatigue. Impact of the research. Research is evidence for the allied health professionals and physicians. This study may also benefit the clinical trials investigating treatment for the Parkinson's disease by age and sex when examining treatment effects. Thank you for the patient listening. You can also find me at sahin@rateofrenix.org.
Thank you so much, Shaheen. That was truly a refreshing and educational talk. I'm sure we've all had a lot of takeaways from this webinar. I will now open the floor to the audience for any questions that they might have. I see two in the chat box. So Vijay asks, was there any effect of the type of medication on physical activity induced fatigue, or is there any correlation with the type of medication?
Yeah, medication use is levodopa. It is found to have some responsive effect on the patients with Parkinson's disease fatigue, but it is not conclusive. So more research is needed on this sector.
I hope that answers your question, Vijay. Nupur asks, physical activity acts as a trigger for fatigue. Exercise induces fatigue in 50% of the people. Does it mean limited exercise or activity is needed?
No,
the
that
limit,
requires,
she says the limit should be set in a personalized manner.
Yeah. Because it was only a survey on selected population, that is 1,029 samples. So further research is definitely required in this field. But it is just a preliminary study that it requires further research.
I hope that answers your question, Nupur. I don't see any other questions in the chat box nor in the question answer session. I would like to thank you for your questions, and I would also like to thank Shaheen again for today's session. And so in closing this webinar, I would also like to inform the audience of the next CellTalk that will be held on the 12th of October 2022. And Mr. Jivil Kapoor will be presenting on the topic economic burden of Alzheimer's disease dementia in Japan. Thank you so much for your presence today, and I hope to see you same time tomorrow. Thank you.